autistic, that it's not necessarily a realistic expectation to just get them right in there and get them involved.
Exactly.
Because they do not have the ability.
And that's exactly the youth I was talking about has
And neither
Asperger's.
do like kids with trauma, PTSD don't have those skills.
Yeah.
It may seem like they should, but they don't, right?
That's like the other girl in there.
Yeah.
Sorry, she didn't want to do anything. And then I would ask her, what do you like to do? And she said, swim. So we would start going to the park so she could swim. She wouldn't swim. So I wasn't reaching my
Did you figure out why?
She had a history of drug use, and so when they would go to the lake and swim, they were doing that, and so I don't think it was even fun to her.
But that's all she knew.
But that's the only hobby that she, I mean, I would say under social learning skills, we are talking about hobbies and how do you spend your free time? Are you used to having social time, you know? I mean, a lot of kids aren't, and they've been through neglect and abuse and drug culture and stuff.
Your brain's wired differently.
Yeah, we had a 14-year-old who, for various reasons, had never had a recreational activity before and had never done anything besides school or treatment. And so we started out just like I would take him to the community center for a specific class for 45 minutes, and it was just like that one thing. And there was a bunch of younger kids in the class, but he was at their level, and I just sit there with like all the other parents of little kids. And it was very structured because it was a class. It wasn't just.
That's a good point.
And it was a really good like.
Yeah, I think a lot of parents have found that instead of like PAL or Boys and Girls Club, get them enrolled in some sort of structured class, and it's a little less scary, or let them have a buddy with them or something. And I mean, it's not just about us deciding that, it's about talking to the kid and finding out, you know. But or we had a kid, I had a kid on my caseload who we actually built in for the a skills trainer to be with him at Boys and Girls Club, and then gently ease out, so that at first he has this person I mean, it was awkward and kids teased him for having this adult with him, but slowly he learned the skills to be able to be there on his own, and how to make friends and understand that, oh, I'm standing too close, buddy.
Yeah,
you know, that
no,
kind of thing.
I think one thing too to keep in mind is with expectations is the volume at some places where you take the kids. Because with severe abuse and neglect, we have a little one that still can't handle like really loud places because it hurts her ears. Same thing with autistic Asperger's, that can be difficult for them because it confuses them, it hurts their ears.
Yeah, sound, we have, it might even be more than sound. These kids are so easily triggered, and they won't even know until they're triggered necessarily what some of their triggers are, right? So,
The sensory stuff is really good at taking through the month.
excellent job, guys. You're doing so well with this exercise. Anyone want to read about Lisa? Not about you. Colleen.
Lisa has emotional regulation lagging skills. She has major tantrums at bedtime and stays awake for hours. Expecting her to go to bed without any issues is not realistic. How might we adjust our bedtime expectations to help Lisa build some comfort and safety at bedtime? And while we're at it, what triggers and patterns do you notice about bedtime for Lisa?
Avoid her computer.
Wear a computer.
Well, yeah.
That's my shot.
So what do you guys think about Lisa?
Obviously had some issues at bedtime,
She has.
I would start with a nightlight. Probably start with easing her into it. Okay, about 30 minutes is bedtime. 15 minutes is bedtime.
And not
Probably still goes
not
straight
coming in and
home.
scolding her when she's not asleep every time that you check on her. You know, I mean, oh, hey, you're having
Disengaging
trouble.
is the best thing she said.
I think I would request some kind of exercise for her, because I think that sometimes the kids don't have enough exercise and then they don't sleep very well. So something that she could do physical, yoga, or something calming to give her, and And because you didn't get teams like that now,
Oh,
and you could just do it at home, and you could show her some yourself.
That's
Yeah.
really good. And doing it with her, I feel like, because you'll help regulate her. This is why, we read stories to kids at night, because it calms them down, the sound of your voice and, all that.
The kid that lives with us now, when he first moved in, was like meltdown every single night. And so he had to sit with the lights on, 2 night lights, and a lamp. And I had to sit in his room like in a chair, like kind of across the room from him. And I would just like read a book or sit there.
And just be there.
Yeah. But it was like months of that until I was like, okay, why don't you try falling asleep without me sitting here for like 2 hours? And like try without like the overhead light on and then without the lamp. And like now he just goes to bed, it's no problem. Like all the lights are off.
And that's you adjusting your expectations, because we'd expect maybe a 13-year-old boy or a 14-year-old boy, however old is at the time, would be able to sleep without the lights on. But you knew that that's not gonna be something you can handle, so maybe we need, more lights.
Mr. Tough Kid's scared of ghosts.
Yeah. Like, that's not.
It's like I would have to say like every night, you're safe here, no one's gonna come in your room, your door is shut. Like we have to look in the closet and look under the bed and like go to the floor room every night.
And you accepted that as part of the job because you have to. He's not there yet. He can't not have that. Yeah, excellent. Okay, moving on. We have so much to cover, but we're having such a good discussion about this. I hate to
We'll get
miss
as far
it.
as we can.
Okay, last one. Who wants to read about Annie?
Well, Annie has language processing lagging skills. She stays in her room writing in her journal and always has headphones on. Expecting her to talk about her feelings is not realistic yet. First, she needs to trust you, so again, we start with smaller expectations.
So what other things might be unrealistic for Annie? She's not good at talking about her feelings, and she clearly has a big bubble of space, right?
Our, what is it, 12 hours?
Yeah. Well, like expecting her to talk to you when you're driving in the car, or to sit at the dinner table with the family might be overwhelming for her,
That is a good question. What do we do when we have a youth like that and we're expected to do 12 hours?
Mark attempts.
You log that you tried to approach them and offered this and that, and like with the rep, with the woman whose kid doesn't want to go anywhere, she needs to offer it, but we don't want the hours by forcing kids in the car and yelling and screaming, oh, there's your interaction. That's not, so it's just about showing that you were available and that you did offer it. And I would say under the CPS lens, are you figuring out, are you noticing a trigger pattern? Are you looking at, is there a way to crack the code of why they don't want to interact? You know what I mean?
Yeah, but the youth I have came in the house completely engaging and now he's not.
Now he's not.
And it's okay to go back, because like maybe sometimes when you make
What
progress,
happens?
we also step back a little bit. When we start, dealing with trauma, sometimes that can cause, like there's a honeymoon at first.
Right.
Yeah,
There's
so
more underneath. What happened?
It's
Why? Who, what, where?
it's okay to go back.
TV.
Yeah, you go back to assessment planning, and it's okay to log attempts when something happened, and then you maybe need to view it from a different angle. So it's okay.
That's actually a beautiful plan B waiting to happen. Okay, so he's watching TV. I'm making some assumptions here, but for the sake of examples, let's say he's watching TV all the time, and you're not getting enough hours. His concern is that you want to talk to him all the time. And your concern is I need to get enough hours for you to warrant you living in my home. So that's your problem to be solved. And then in a plan B, you're kind of like, here's our shared problem. What are we going to do about it? We have to work on this together.
Because he acted such a mess a week before he lost the TV, so now we have plenty of hours.
Okay.
Well, that's the problem. We can't do what we're gonna do.
I don't know.
Well, that's your proactive conversation. Okay, when you get your TV back, I'm worried we're not going to talk enough.
Yeah.
And we'll get into that when we get to I'm jumping ahead.
Lisa?
I think also with language processing, a lot of times the kids that come into care, at least a lot of kids that we have had, you have to remember their age level again may not match your language level, and they have issues with understanding what you're saying, so sometimes you have to really break it down to where it's more, you may have that child, that may be a teenager, but they may need it explained more like a 5-year-old would need it explained, or even finding, if they're young, even finding a way to talk with them and express things to them at their level, and remembering that they're not necessarily understanding anything they're saying.
And it can be hard to see that and look through all that, like, I mean, you guys worked with a lot of the gang kids and stuff, and like, there's so much attitude or this or that, they don't want you to know that they can't read or that, you know, whatever, and so looking through all that, you know, and meeting them where they're at, very, very important.
The other thing is if the child is watching a lot of TV, then instead of taking the TV away, what I might do is find a video that might prompt discussion. You know? You know, go find a movie and you go, oh, you know, this one talks about a child that doesn't talk a lot.
This movie's about a foster kid who
has
your
being bullied all the time.
We need to make these movies.
At the library.
That's a good idea, though.
That is a good idea. There's some
Yeah,
really
it
good
is.
books on bullying at the library.
All right.
And you can have the kid read the book and talk about the different characters.
Okay, well, we're gonna move on.
Here's some things, as we move from planning, you guys are just having too much fun in this class, I love it, you're our all-star class. As we move around, we're somewhere here between planning and intervention, okay? We want you to be asking yourself, in terms of setting expectations for the youth in your care, do I have a valid reason for what I'm expecting? Is it a big enough concern where I do need to set the bar where it is, okay? Is it worth possibly causing a major problem? My expectation is that you come out of your room and engage with me. And that might set them out. Or my expectation is you have to go to PAL. You know, is it worth causing a major problem? Obviously not, you know. Do I know why this is so important or hard for the child? So looking deeper, listening closer. How will the child react if I keep that expectation in place? Or can I adjust it? Is it something I can be flexible about? Or if I can't be flexible about it, am I prepared to be patient and helpful towards the child's reaction? And I feel like, it sounds like you all are very skilled at doing this, actually. It doesn't come that naturally to all parents, but I'm hearing from how you've done this exercise, very impressed with what I hear.
My turn.
Go on.
So before when we were talking about like being in the planning and intervention, we're actually now gonna move into the planning. So like when you're kind of doing this, I'll talk about that. It's doing more of assessing of how we're gonna go. So we now know what we're gonna do about, we're ready to move into our planning phase, and now knowing what we know, we're gonna figure out what to do with the problem. Okay, so we spent a lot of time, you know, backing up, taking a bigger focus, looking a little bit deeper. We look underneath the problem. We know we can reduce problem behavior by having these realistic expectations. You know, just making those accommodations by having those realistic expectations. Now it's time to talk about what to do when we have unmet expectations. So we're going to examine our options for approaching the problem. And this is all planning ahead. So if your expectation is not being met, we need to know what your options are for responding. We need to have a plan. We need to look at the problems in terms of priority and know what your concern is and why you need your expectation met. And then you have to look at your concern in terms of the child's skills. And this is just to kind of go forward a little bit. We're looking, you know, when we have our interventions, this is what we're aiming to do. We're trying to pursue high priority expectations. We're trying to reduce challenging behavior. We're trying to build trust and understanding. We're trying to clarify lagging skills and start teaching them. And we're looking to solve chronic problems permanently. I cannot talk today, I'm so sorry.
So our interventions are based on concerns, right? We're intervening, we're doing something, we're addressing something with the child because we have a concern about something.
Problem to be solved.
This is all kind of part of that. That's what that's all about.
And so you guys probably know this already, and if you don't, here we go. There are 3 plans you can use in CPS. This is how they kind of break it down, and so it gives you lingo and a shared knowledge on how we can, you know, address the situation. Plan A is imposing your will. Plan B, collaborate and problem solve together. And Plan C would be dropping the expectation for now. So again, Plan A is imposing your expectation, or not imposing your expectation and concern. Plan B is collaborating and problem solving together, and Plan C dropping it for now. Okay, so we're gonna talk briefly about when to use which one. But first I'm gonna clear up some.
And then we'll probably review these later too, but this might not make sense until we get into it.
Yeah, and this is a good important slide. But just in general, so just like take it at face value, you don't need to use a plan unless you have an unmet expectation. So setting an expectation is not the same as imposing your will on an unmet expectation. So me saying, Margaret, will you please go clear off the table? That is just me setting an expectation.
Go clear off the table. That's still just setting an expectation. If I say no, hell no, I'm not clearing off the table, and then she goes,
Margaret, you better go clear off the table or else I'm gonna ground you.
that's plan A. That's imposing her. She doesn't care why I don't want to clear off the table, she just needs me to do it, right?
Okay, and plan, just to also clear up another bit, Plan B is not picking your battles or an average of Plan A and Plan C. Like Margaret said earlier, there are no quote-unquote battles in CPS. We're really trying, we really want to look at it as a way to build skills. We also do not view Plan B as a technique, although there are steps involved and, they give you Plan A, Plan B, Plan C. These are just like to help guide.
It's a process.
Yeah, it's a process. It's to help guide, to give us all a common language on how to talk about this, rather than like, if I say, Margaret, if I say, Margaret, blah, 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 I know, and then Margaret does blah, 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 and then I interview, it's not like that. It's not prescribed like that. It's gonna be messy, there's gonna be different outcomes.
It's gonna have a lot to do with your personality and how you naturally engage with people and children.
What?
I'm trying to figure why I'm so confused
Are
right
you
now.
confused? What are you confused on?
Every time this word plan A, B, and C comes up, my brain just shuts off.
We're gonna go into more detail
Yeah,
about
we'll
it.
talk about them.
Would that help?
It's
okay. So this is Plan A, B, and C are like, there are intervention tools, or I don't want to say tools, but they're what we use for interventions with kids.
So we've talked about how we assess what's going on with kids, right? We've got looking at our problems to be solved, looking at triggers, patterns, knowing what we know historically about the kid, and then we go into planning where we think about what are our expectations of this child, what are we concerned about their behavior, do we need to intervene? And when we talk about actually going in and talking to the kid who's in a crisis in his bedroom, throwing things, are we going to approach with an A, B, or C?
And
Okay,
it's just
does that
like
make sense?
it's like an abbreviation for how we deal with it. Like it's not. We're also gonna all the rest of the classes we're gonna go over this over and over and over again.
We're gonna play a game, I think next week, called Name That Plan, where we watch videos and you tell us which, if it's A, B, or C. So this is not the only time, that's all, we're halfway through classes after today, actually. And the whole second half of the course is about Plan B, how to use it, and how to use A and C as well.
So we have options for unmet expectations, and those are utilizing Plan A, Plan B, or Plan C. And we're going to look at all the plans in detail. The first plans we're going to look at are A and C, because those are, I don't want to say the easiest, but they're the least complicated of how we
These are things you're already doing most likely, okay? You're letting some stuff go and you're demanding certain things other times, right? I mean, that's kind of the rhythm of parenting. Is like there's some things you can't be flexible about and you're like, you have to do what I say. And then there's other things that you're like, it's okay. I'm not gonna worry about that one. I'm gonna ignore that, let that go.
Yeah. So we use Plan A, or we impose our will, same thing, when we have concerns related to safety, learning, health, or impact on others. Plan A, or also imposing our will, is for serious urgent enforcement of unmet expectations. So I'm going to give you some examples of what Plan A sounds like. Let's say I said, Margaret,
Let's say
Margaret, you need to do the dishes, please.
night.
No, you need to do the dishes. So that would be an example of me.
What if I don't?
I need you to do the dishes or you are going to be grounded for 100 weeks. Or this is not up for discussion.
It's not up for discussion. I don't care why she doesn't want to do it because it's urgent. I need them done now. And it might not be something like dishes. It might be something, but I need you to put down the knife.
That was my example yesterday. I was going extremes. Or you must, you can't.
I need you to put down the
I need to
knife
take
in
a
your
time
room.
out now.
Yeah.
Stop it now. This is not up for discussion. And it doesn't even have to sound like as harsh as I'm
Yeah.
sounding. It can be like, so Margaret,
I hate washing the dishes.
Okay,
It's
well-
always about the dishes.
Margaret, I know you don't want to do the dishes. I hear you, like, you don't want to do the dishes, but I really need you to do the dishes or else I can't pay you your allowance.
God.
That's another example of what a plan A looks like. Does that make sense? Does that make more sense, Stephanie? I'm not gonna pick any up, but I am. And if it doesn't.
We don't want to race too fast. We want to stay, we want to make sure you guys get it.
So like I said, imposing your role is not always done in a harsh manner. It's not always like, Margaret, do your dishes or I'm going to ground you. It's really done.
Plan A is the mean one, right?
Yeah.
It's not like that.
It's really done in a
Because-
variety of styles. Because some people impose their will by yelling, but others do it in a cooperative, helpful tone. I remember like one time, like when I worked at the group home, my expectation was like, well, everyone needs to chip in with the housework around here. And so I would, you know, like one of the girls would be like, I don't want to do the dishes. Well, you have a choice, sweetheart. You can either do the dishes or you can sweep the floor.
I need you to do something,
I need
so
you to do
which one
something.
would you prefer to do?
And
That's
those-
still imposing your will. Does that
Yeah,
make
because
sense?
I'm meeting my expectation without really I almost said a bad word, without really caring what her
Giving an
expectation is.
F.
Equation. I want to confuse like.
So classic example, how many of you are familiar with like love and logic? Yeah, okay, so the idea behind, love and logic is our ideal plan A, what we would use. It's where you basically say, I'll know you're ready to do the dishes when I see that you have either got the gloves on or
Yeah.
got the soap ready. You know,
Yeah.
it's like I'm still imposing my will and I'm giving choices and I'm being kind and I'm being supportive, but I've totally cast aside any concerns the child might have about any triggers, anything. I don't care. I just need her to do it. And actually the dishes probably isn't the best example because
Going
we
to
would
pout.
encourage you to not, unless something has triggered the child so they're acting so extreme that you need to, like, it's all about safety, health, learning, impact on
It
others.
could be an impact on others though, like if this is the culture of the house and that we all, you know, we all chip in to clean and so you're concerned, you're like, yes, this impacts others, this is how my house works. They won't say they won't do the dishes, this might be a great, and you feel like you need to plan A it, then, I would say, look at your expectation though, like if who really wants
If you
their house?
notice every Friday the dishes are a big deal and she gets all upset on Fridays about the dishes, obviously you're seeing a pattern and a trigger and it's like, okay, I need to look closer at some point or we're gonna have this problem every single week.
Yeah.
You can be as kind as you want, but it's still a plan A if you're not listening more about like, I wonder why she hates doing the dishes, I wonder why he hates going to PAL. You know, why do we get into a thing about PAL every time?
So you're imposing your will, you're overriding the child's will. In Plan A, there's no room for the child to contribute ideas. And in Plan A, we aren't concerned with the child's concern. Really, what Plan A is great for, like if a kid is about to run out on the road. Stephanie, you need to come back here right now or else I'm going to have to ground you. Because, you know, and that, right now we're working towards safety. Stephanie, you cannot eat soap because that is gonna make you really sick. You know, like things like that, so.
So plan A, B, and C is not going to be used every single scenario in the home.
No, it's gonna be
That's
used.
what I was.
Because when you're using CPS, it isn't just Plan A, B, C, it's everything.
Right,
It's
okay.
talking about lagging skills, it's talking about triggers, patterns, that's all under the
Because I
umbrella.
was trying to figure when I was doing my notes one time, now how am I using the CPS, A, B, and C when we're just talking about the day's emotion?
It's
Yes,
only when
that's
you're
not gonna be-
pursuing
Yeah,
an unmet
That's what I was
expectation.
thinking, I was like, how am I going to incorporate this
Yeah,
in everything?
so the
every
notes
day?
were
Okay.
making it confusing, I see. These are only for all unmet expectations, okay? And you can have a Plan B that isn't necessarily about an unmet expectation, which is sort of a confusing thing for me to say. But if you're working on building empathy and rapport, or you're trying to get to the root of a problem, you could count that as a Plan B.
Here's some, again, we're gonna just clarify some important things about Plan A is that it really focuses on your concerns only. And sometimes it's necessary, but it's not always necessary. It really treats symptoms. You know, it will treat that outside external behavior, but it's not going to help build any skills internally. We're not changing the intrinsic motivation of the youth.
We're not building skills, we're just creating skills.
It helps enforce the safety and well-being, and again, I'm just gonna say it again. It does not teach skills. It can stop challenged behavior in the moment, but it's not enough to prevent it from happening again. It's really important that and we'll talk about why. But we always need to follow up a Plan A. So when I'm pursuing my expectations and my will, we want to follow it up with a Plan B.
So a classic role play, then you can log about the follow-up, right? That's a positive, proactive thing. So classic example that Anna and I like to act out when is like one of us is the foster parent and the other one is the kid who doesn't want to do the dishes or take out the garbage
Trash,
because it stinks or whatever. So we go to a movie every Friday night as a family, and we've got to just really get those chores done because if we don't, we're going to be late because the movie starts at 6:45 or whatever, and we always have a thing about her throwing the trash. She doesn't want to do it. It turns into this big thing. If I was going to Plan A that, I would be like, I don't care. I need you to just do it because we're going to be late for the movie.
Fine, but you're still a stinky boo-boo head, like, you know, and then I like go
she's
off
mad,
and
right?
and
But then, after the movie, we had fun, it was a funny movie, everything's good, we get home, and I'm like, following up with a Plan B, I'm like, so, we're feeling a little better, right? Because we had that, I'm sorry we had that thing, I know there's something about throwing the garbage that you don't like, I wonder if this might be a good time to talk about it. So then you work it out and you talk about it and you start chipping away at that problem. Okay.
Do you guys want to take a quick 5-minute break, or do you want us to try and get through this?
Turn the air conditioning on. Or open the door.
We can open Chelsea's door, maybe?
We can open that door. We can open the
Sunday
doors.
is,
Because if we can get through the Plan C part, which is similarly to the Plan A, then it's probably a good time.
Okay. So Plan C, and this is where we are dropping our concern or expectation for now. We use it to stabilize, to calm things down, to focus on more important concerns, or to prioritize problems. Plan C sounds like this. Like, let's say I tell Margaret to go do the dishes, and she's like, I'm not gonna go do the freaking dishes. Then I just would say nothing. Or I'd say, okay, okay, well, we can talk about this later. I'm gonna let this go for now.
So back to your example, let's say you're like, no, absolutely not, I'm not gonna do it. I could be like, you know what, we don't have time to battle about this right now. We have to I'm just gonna do it, and we'll talk about this later, because we need to get to the movie, right?
I know.
And then we'll follow up with the B later.
Something that I often I'm like, that's really interesting, but why don't I check in with you about that later? Like, that's a classic Anna statement. Plan C focuses on the other person's concerns only. In our case, it's going to focus on the child's concerns only.
Some people see it as, well, the kid gets to win that one, right? Because you're not going to feed into it. You're not going to power struggle about it. You're just going, you know what? No, I don't care.
But
letting it go.
What we're trying to say is that there are really valid reasons to use Plan C.
There's a time and a place to
Using too much Plan C or too much Plan A, it's going to do some, not damage, but it's not going to help build skills or increase the therapeutic relationship that you guys have. It's really about, Plan C is about careful timing. You're reading the other person's cues and trying to reduce tension. I know that you all have had NCI, so this might be like, you can kind of see them start to get escalated. I'm not going to go quarter them in a room at this point because I'm going to let it go, and we'll revisit.
Throw that garbage right now. We'll never make it to the movie. We're going to have a big blowout.
Yeah. And this also might mean dropping one expectation and presenting another. And
if you don't want to throw the garbage, how about you sweep the kitchen floor instead?
So we're dropping the garbage expectation and now I'm going to sweep the kitchen floor. It may be like you present an expectation for a child and they just skyrocket and now we're worried about their safety, so we're going to say, I need you to stop scratching yourself because it's an because I'm worried that you're gonna hurt yourself. So that's another idea of how we're dropping the expectation and presenting a different one. Does that make sense? Oh, cool down already. Plan C does do some great things. It really helps keep the relationship open between you and the child.
But it also can damage it if you're doing it all the time, like going back to our vignette from last week about Mary Ann, right? She was walking on eggshells and Plan C'ing everything with that kid. She wasn't addressing anything with him, and that was creating a thing where she was getting walked all over. We don't want you to do that either. It's about you and the child equally.
So you will always follow up Plan C with a Plan B later on during a better moment. It's really important, your concerns are just as important as the child's concerns. And so what you're doing when you meet an unmet expectation with a Plan C is that you're not closing the door. You're not saying to that child, you know what, I don't really care about your concerns because I need you to do this right now. What you are doing is leaving it open so that both of your concerns can be met at a later time. Does that make sense? It will make more sense.
It's a rhythm.
Yeah. So this is a chart that we've probably shown you before, and if you haven't seen it, it's a really great chart. This explains what each plan can or cannot do. And
This
earlier,
goes back, yeah.
sorry.
Go ahead.
Earlier on, we were talking about what is the point of intervention? Why do we intervene? And so these are those goals. We're trying to get our expectation met. We're trying to reduce challenging behavior. We're trying to build skills. We're trying to solve problems. And we're also trying to build a relationship and confidence within the youth. And Plan A will get your expectation met, but it's not going to do any of these.
In fact, it might increase challenging behavior.
And it might close off your relationship.
Possibly damage relationship.
And
Slamming that door shut.
Plan C may reduce challenging behavior in the moment, but it's not going to build skills. You're not going to get your expectation met. You're not going to solve problems. And if you continually utilize Plan C, my guess is relationship and confidence will kind of go out the window too.
It might help in the moment though, because the kid will be
Yeah.
like, all right, she or he is off my back right now.
Yep. It definitely will help in the moment. I'm talking more chronic, like Mary Ann, weeks.
Needs to figure it out.
So Plan B